Hey, y'all, welcome back to another episode of Confessions of a Male Gynecologist. I am your host and the author of the Hormone Balance Bible that you can get on Amazon right now. It's consistently in the top 100 books on Amazon in women's health, and I think that's for a reason. I talk about the 12 most common hormone imbalances in women, hormones themselves, the lab testing, and then how you can fix your own hormone imbalances by just simply doing the things that I recommend. There's spiritual practices, hormones, energetic aspects of medicine, nutrition, exercise, and supplementation. That being said, what do I want to talk about today? Let's talk about sex, baby. Let's talk about you and me. Yeah, you remember that old song from Salt and Pepper, and Spinderella. Basically, I get this topic in the office on a daily basis, sometimes multiple times a day, and that is surrounding libido. And I have many women that come in with that as their main complaint. My first question is, are you coming in because the decreased libido bothers you, or are you coming in because the decreased libido bothers him? Because those are two different topics completely. I think there are many times in a couple's life and growth together where they don't see eye to eye when it comes to libido. Men who tend to have higher sex drives and all they got to do is wake up with an erection and have sex. Women, it's more of a process. And in many instances, their partner is the one that's somewhat responsible for the sex drive, not them in and of themselves. And so what do I mean by that? Well, I have a lot of women that will come in to the office or do a telemedicine visit, and they'll say that their testosterone must be off because they have no sex drive. So that would insinuate that the level of testosterone in your body is a 1-to-1 ratio of, the higher your testosterone, the more, the higher your sex drive. And I think that's not necessarily the case. In some cases, so it's indirect, meaning if you want a sex response, you have to be in the mood, right? But if you're exhausted, if you're stressed, if you have little kids, you may not be interested. Now, testosterone plays a major role in a woman's sex drive, but replacing the hormones or replacing it with a supplement isn't always as simple as it sounds. It's kind of it's something that can definitely drive sexual desire. But the sexual response, the first step of the sexual response in men and women is arousal. Men, it's pretty hard to hide the arousal because you have an erection. With women, you have to eliminate many of the aspects of the reasons why she doesn't want to have sex before she'll be in the mood to actually have sex. So I do have many podcasts on testosterone, and I talk about all the time how it is probably the number one most abnormal leveled hormone, meaning imbalance, I'll just say imbalanced hormone in women across all age groups. In younger age groups, 20-year-olds, it's because of birth control pills. In other women older that aren't on birth control pills, it's usually obesity, diet, lack of exercise, genetics, where you live, sleeping, stress, things like that. So there's definite reasons for women to have low testosterone. Even in men nowadays, we know that testosterone levels just simply aren't what they used to be. So let's say I see a woman with an abnormally low testosterone. What I usually will say is, now I can raise your testosterone to the level of a man's, but that doesn't mean that you're going to want to have sex with him. Now, you may want to rip his face off, but you may not want to have sex with him. So it can definitely make you more aggressive. but it may not be something that fixes your problem. I mean, it may be something that you still have some issues with. And so I just want to put that out there. So I would definitely come in with a complaint of decreased libido. I think that's a legitimate thing. I think that it's something that you definitely want to look at, but it's not the end all be all, I guess, is what I'm taking. So there is this, patients will come in and call it decreased libido. And it's actually a medically diagnosed, has a medical diagnosis called hypoactive sexual desire disorder. We have to put a real fancy name on it, HSDD, which is basically a low libido. So there are things like increasing testosterone that can certainly help, because if you're tired, if you just don't care, if you're kind of bleh, meh, well, then you're not going to be interested in sex. So getting your testosterone level up to a normal level could definitely help, but so can sleep, so can decreasing stress. I often tell the guys, if they come in with the visits with their spouse for the visit, there are some rules to engagement, right? I mean, I always put this proviso in there that I'm divorced, so I'm obviously not an expert when it comes to relationships. However, things that I have learned over the last 10 to 20 years. Number one, she doesn't want to have sex with a jerk. So if you are being a jerk, rude, obnoxious, immature, whatever it is, then you can't really expect a woman to be wanting to be with you. And number two is, don't go up to her in the kitchen and put on your best moves, which is exactly what I would try to do. Do the dishes, because it's not about you putting on your moves, because you've already done that a million times. You putting on your sweet moves in the kitchen may be funny once or twice, but on the 100th try, it's probably not going to work anymore. But what might work is you telling her to take a load off, go sit on the couch, or go do something she wants to do, and you do the dishes or the laundry. So here's something I learned being single for the last 7 years. I realized that laundry is a process. See, I used to think that you could just put the laundry in the washing machine and voila, you did the laundry. What I learned being single, though, is that you have to then put the clothes in the dryer, then you have to take them out of the dryer and fold them or put them on a hanger, and then you have to put them back in the closet or in the drawer or wherever they go. So it is a process, and man, I thought I was just getting credit this whole time. I probably wasn't getting credit because I was just putting it in the washing machine. So let's work on testosterone for sure, but also keep in mind all of the other factors. Now, one of the things I wanted to talk about in this episode was this pill that improves a woman's sex drive. Now, if I were to say to you, the blue pill, everybody knows that that means Viagra, I think. I mean, they've done an amazing job at marketing the blue pill. And it makes a lot of sense that the pill would be colored blue because blue is considered for boys. And the reason that Viagra works, the way that Viagra works, is that it increases blood flow to the penis, because men that have erectile dysfunction may have poor blood flow to the penis, and so they can't get an erection. It probably has nothing to do with arousal as much as it does with blood flow. So men who are on these medications have increased blood flow to the penis. That's how they have an erection. So it's a blood flow issue. But I think what Viagra did, the company that makes Viagra, they really were genius in the way that they marketed it, blue pill. So if I were to say to you, a pill was coming out that was supposed to help women's sex drive, what color do you think they would make it? Pink? Ah, yes. They made it pink so they can call it the pink pill. The thought process for women that have ever come in wanting to be on this new medication, it's called Addyi, Addyi, or the generic is philbanserin. they would make it pink because they want to hop onto the marketing that has already been done by Viagra. And Viagra makes men want to have sex. And it doesn't really make men want to have sex. It makes them able to have sex. There's a difference because these men that are on Viagra may have wanted sex. They just couldn't because they had a, for lack of a better description, a limp noodle. And so they couldn't have sex. And the Viagra then gave them more of a pre-cooked noodle. So there was, it was more firm, as they say. So the thought process being when they say the pink pill or when they make it pink is that they were playing off of the blue pill. The thought process being, I think with most people, that Viagra increases desire, which isn't what it does. It increases the ability to perform. So with women, you're already, in a sense, kind of being marketed and almost lied to, in the sense that your implication is that the pink pill is going to work the same. Now, how does the pink pill work? Well, first of all, when you take it, it's not one of those, it's not like Viagra. You can't just take it on demand. So you can't just be like, oh, it's Saturday, my husband's going to be wanting me to have sex, so I'm going to take this. You have to take it every day. And according to the company, you have to take Addyi at least 2 full months to realize the full ongoing effects. Although some women do experience results in as little as 4 weeks. That was seen in clinical trials. Women reportedly experience more desire for sex, less distress associated with sexual desire, and more satisfying sexual events per month. So more desire for sex and less distress associated with sexual desire, I think those kind of just go hand in hand. They're kind of repeating the same thing, because if you don't have desire for sex and it's affecting your relationship, you're already stressed about it. And so if you have more desire, then the stress should go down about not having sex. So that they listed 2 things, but those are kind of just rewording the same thing. Now, the more satisfying sexual events per month is kind of an interesting concept. So Addyi should be taken at bedtime, and you take it as directed by your healthcare provider. It helps decrease the risks of sleepiness that can happen, low blood pressure, fainting, and accidental injury. This was one of the complaints when it first came out, was that, one, you couldn't drink alcohol, and so that pretty much excluded probably 90% of the population, and that it could make you dizzy, sleepy, and things like that. So the concept of Addyi with alcohol, if you consume up to 2 drinks, you're supposed to wait 2 hours before taking the medication. And if you have skipped a dose or 2, you can actually have 3 drinks. The problem being is that it lowers blood pressure. So you combine that with alcohol, and women were having issues where they were passing out. So the thought process with libido is that the interest in sex begins in the brain. Hypoactive sexual desire disorder, or HSDD, is believed to be caused because of an imbalance in the chemicals in the brain. So this is a thought process. A study examining the brain scans of women who were exposed to erotic materials showed that women with HSDD had little to no activation in certain parts of the brain, and women with HSDD, you can basically have issues with vaginal vasocongestion, lubrication, and decreased desire in general. So do I buy into this? I guess. The stress that comes from the decreased libido, 1 in 10 women supposedly have decreased libido. 1 out of 3 argue with their partner about their lack of desire. Now, this is an interesting stat. 1 out of 3 women argue with their partner about their lack of desire. This is a problem because most of us, if not all of us, will go through times in our lives when we're not as sexually active. It just happens. For women, that could be they've got young kids, they aren't sleeping well, they've got a job, they're stressed. I mean, it can be everything that life throws at you. The problem being is men have a really good way of making you feel like it's your problem, because they'll be like, well, I want sex and you don't. So then you're accused of cheating, and 1 out of 3 women worry that their partner's cheating because they're not sexually interested, so they feel like he's going to go elsewhere. And then 2 out of 3 women who have this feel less connected to their partner. Those are some pretty big numbers. So it's something that we need to talk about. And the thing that I find with Addyi, or this pill, is it works on neurotransmitters. So it works on dopamine and serotonin, which are basically Wellbutrin and Prozac. When this first came out, I had a problem with it because it looked to me as though we were telling women that because we're working on dopamine and serotonin, and it's like Prozac and Wellbutrin, that we were basically telling women that it's all in your head. That sexual desire disorder is your problem. It is an issue in your brain, and it is an issue that we can fix with a pill. And that's not necessarily true. I mean, for some women, maybe, but not for most. And I just feel like women were kind of getting shafted. And then you throw in the pink pill marketing. It just seemed a little bit disingenuous by the company that they were trying to make this more marketable, because this came out years and years ago and it didn't really gain any traction, and it's because of all the side effects, and in my opinion it just wasn't really great indications. You know, I think it's nice that we have, what's funny is we have an FDA that will approve a product like Addyi, which basically tells women that sexual desire disorder is in their brains, but they won't approve any testosterone medications. There are basically zero FDA approved testosterone medications on the market for women, and there's probably 12 for men. So women are left holding the bag. Here, we're not going to give you testosterone to help with your hormones, but we're going to give you an antidepressant called Addyi that we're going to market as a pink pill, because we don't want you to really think that we're saying that it's in your head, but it's all in your head. They're sending a conflicting message here. I guess you could look at it and be somewhat happy that at least they're trying. They're noticing, and they are kind of trying to get you something. Why they won't approve testosterone, I have no idea. So let's look at this. Decreased libido, 1, is not your fault. It could be just a stage you're going through. It could be, maybe for a few months, you got a lot of stress going on. You should really look at the stress in your life. Are you sleeping good? Are you exercising? Are you doing all the things that you need to do to be happy and healthy? And then, are you in a relationship that feeds you? Are you in a relationship that you really love the partner that you're with? Because I'm going to tell you, you don't want to have sex with somebody that you're not really caring about. I suppose there are some women out there that are like us men, and they can have sex, a one-night stand, as it were, and enjoy it. But I would venture to say that that's mostly a male trait, and that a lot of women aren't out there simply looking for a sexual encounter. They're looking for quality. They're looking for understanding. They're looking for connection, chemistry. Men, I don't know if we always think like that. It probably harkens back to the book Men Are From Venus, Women Are From Mars. Or is it the other way around? I don't know. But anyways, it's a dichotomy that often stands out, and men and culture have a way of implying that it's all your fault because it's easier that way. I mean, y'all are used to being blamed for things ever since Eve ate the apple. So why don't we just throw HSDD in your lap as well? Not fair, I know, but that's just kind of what happens. So that being said, I think, the question would be, how do we go about checking this out? Well, I think the first thing to do would be to get your hormones checked, because we know low testosterone can amplify this, can make it worse, because you don't have the drive, the desire, the motivation. You just don't feel it. So why would you be interested in sex? We can eliminate that. If that does, I have women who their testosterone is fine and they still tell me, I still don't want sex, and they're frustrated. And I have to tell them at that point, we might want to talk about seeing a sex therapist or a relationship person, because at least from what I can tell, it's not related to your hormones. Now, and I've also seen it where we got her testosterone level up and then she became very sexually active to the point where she reversed the tables on her husband, and it wasn't her that was saying she didn't want sex. It was him saying that now he was complaining because she wanted it too much. Now, keep in mind, the average couple has sex 2 times a week. I think most of us, especially women, would probably think that was fine. Probably 95% of women would say 2 times a week is fine. Guys, most men probably do want it more than that. And it can be kind of when it becomes a problem is when it becomes a long lasting joke that, precipitates conversations. It's said in public places to make fun of you. And I know it's all done maybe sometimes in good faith, just as a joke, but it can hurt and it can sting and it can make you feel different and off. And that's why I think women come in searching for answers, because they feel like there's something wrong with them because they're not interested. And the reality is you're fine. You're normal. He just wants sex more than you. And in one way, it's good because he still obviously is attracted to you and thinks you're great. When it becomes a problem is when he starts throwing that in your face and using it as a weapon to make you feel bad, because for some reason men think that's going to work, shaming you into sex, but all it does is make you mad. So I wouldn't go there. That being said, I think we've covered this topic. I would like to look at, if you got my book, The Hormone Balance Bible, the archetype of low testosterone is called the nun. And that's because I joke, you don't want none, you ain't getting none. But a nun, also the good nuns, don't have sex. Now, low testosterone can also contribute to bone density, mental health, and good outlook on life. Can also look like, decreased workouts, the recovery's a little bit slower, decreased drive, motivation when you want to take a nap in the afternoon. So there's a lot of other reasons to supplement with testosterone. It's not just libido. And I also talk in my book about supplements you can use, how to raise your testosterone naturally with exercise and diet, and a spiritual practice for the nun. Being a nun is a problem when a nun is cloistered, meaning when she stays in the house all day and never comes out. So the spiritual practice that I try to get nuns to participate in is going outside, going out and doing something, even if you don't feel like doing it, making yourself get out there to do something that you may not want to do. But once you get out there, you really enjoy it. So, just pushing yourself a little harder sometimes to go out and do the things that maybe you don't feel like doing. I would encourage everybody to find a doctor that will check your hormones, that will look at your testosterone and not just look at the total, but look at the free testosterone, look at the sex hormone binding globulin, and make sure that they aren't just band-aiding you, and really make sure that they're not giving you testosterone pellets or injections. Until next time, I am Shawn Tassone, America's Holistic Gynecologist, and I'll catch you on the other side.